We're talking mostly about bullying, but a little bit about PreVenture in here as well, and how I did make use of PreVenture to look at whether it could help with bullying. I'd like to acknowledge the traditional custodians of the country throughout Australia and recognise the continuing connection to land, water and culture, as well as the traditional custodians on the land that we are on today and anyone that is listening via Zoom. I'm going to talk about bullying, what it is, how common it is, a little bit about why people do get involved in bullying, some risk and protective factors for bullying involvement, and a little bit on the harms or consequences of being involved in bullying. Then I'll move into bullying intervention. So an overview of the sort of typical universal school-based bullying prevention programs, a little bit on targeted prevention of bullying, ideas for treatment of those involved in bullying, and then I'll hone in on the personality targeted approach to bullying intervention and have a look at the PreVenture outcomes. So what is bullying? We often use the definition used by Olveus, so one of the very famous bullying researchers. And this definition differentiates bullying from sort of general peer aggression. And really, for an active peer aggression to be considered bullying, it has to be repeated. So it has to keep occurring over time, not be a one-off event. It needs to have some intentionality, so not be kind of reactive aggression. And there has to be an actual or perceived imbalance of power between the victim and the perpetrator or perpetrators. That could be in terms of physical strength or social status, as well as systemic power, such as ethnic minority groups or disabilities. This third factor can be quite hard to measure because it can be subjective. It's part of some of the difficulties in measuring bullying that I will get into as well. In terms of bullying, we often think of the bully and the bullier in the person that gets bullied. It is a little bit more complicated than that. So yes, there are some people that are involved in bullying perpetration that are not ever bullied, and vice versa. There's some that do experience bullying but don't bully others. There's also some that both get bullied and bully others either simultaneously or over time. There's bystanders, so they're not specifically involved in the bullying, and they do not intervene in the bullying, they just happen to be around. But there's also defenders, so they are people that jump in to try and stop the bullying. In this presentation, I'm going to be speaking mostly about adolescent bullying and a combination of the other two. In this paper, it's mentioned that a lot of this research on the risk and protective factors for bullying unfortunately comes from cross-sectional research. So it is hard to talk about any kind of causal role for a lot of these factors. So it could well be that some of those relationships are more causes than consequences of involvement rather than risk factors for becoming involved. However, there is some good longitudinal research around emotional distress. So it's pretty clear that there's a bidirectional relationship. So if you are prone to emotional distress and being reactive with emotion, you're more likely to be involved in victimization and perpetration, and then you're more likely to experience those kind of harms, and then they exacerbate each other. Speaking of harms, this is, I guess, a big focus of the literature. So there's a lot of evidence around the ideal world. For bullying, we would have a nice three-tiered approach. So we want to see prevention of bullying, early intervention for those that have been involved, as well as clinical treatment for those that have gone on to experience problems as a result of bullying or in addition to bullying. However, it's not really done like this so much. There's a real lack of research and guidelines on early intervention and clinical treatment for victims and or perpetrators. According to Allison and colleagues, so there's a huge void between the established adverse effects of childhood bullying and the evidence-based for clinical intervention. So most of the research is looking at harms, very little on what we can actually do, particularly on the more clinical end than the universal prevention end. On top of that, most bullying interventions are not evaluated. So many of interventions that you'd see going into schools, we don't know if they work or not. Even the ones that do are not hugely effective. So a recent meta-analysis showed that bullying interventions significantly reduced bullying perpetration and victimization. It had small effects, so reducing perpetration by about 20%, victimization by about 16%. Makes sense with the universal intervention. However, that's not going to be enough for some of those, particularly those with those pre-existing vulnerabilities. Interestingly, in a paper by Rappi and colleagues a couple of years ago, they found that bullying interventions were becoming less effective over time, which in a way is probably a good thing. They alluded to, there's more widespread anti-bullying policies and programs around, so it's hard for them to have an effect over and above the school's usual practice. Another problem with the school-based interventions is that they tend to be quite hard to implement in schools. They can be quite involved for teachers. So, as with many interventions, that the poor implementation of them can be problematic and reduce the impacts as well. So there is a big call for more targeted bullying intervention. As I said, most bullying programs involve all students regardless of risk for bullying. Rigby and Johnson recommend that more attention is paid to those students that are most vulnerable to bullying. And we also really need to improve interventions for those that have been affected by bullying. There's really limited research on targeted interventions. The ones that are out there tend to be for victims only, not many for bullies or bully victims, even though bullies also experience psychological harms and bully victims are the most disordered group. Also, most targeted interventions focus on teaching social skills, but from the research, it's not necessarily the main factor that we should be addressing, and the effectiveness of teaching social skills is quite limited in terms of bullying intervention. These are some of the ideas that I've pulled out that we could address in terms of clinical intervention if you had someone that had been involved in bullying and needed support. Can I just check in terms of time? Very good. 10 minutes to go. Okay, I'll whiz through this so that I can focus on PreVenture at the end. But as you'd expect, treatment would address more just than the individual, but be looking at the peers and parents and kind of broader factors. There's pretty good indication that CBT would be helpful. So you can be looking at those cognitive factors such as the beliefs about themselves, behavioural experiments, social skills training, emotion regulation would be key, looking at their self-esteem, self-concepts, as well as, if you can, parenting components, and clearly kind of assessing for and addressing any externalizing problems. Similar for perpetration, you'd be wanting to have that kind of broader approach. You'd be probably basing a lot of your treatment on aggression, CBT for aggression in children and adolescents. Again, cognitive components, but you might be, say, more looking at their beliefs about others or their beliefs about aggression. Behavioural modification strategies to replace aggression with pro-social behaviours. So it could be, you want to become more popular. How could you do that in a different way? Social skills training, but being aware of that person and what kind of social skills training they need, if any. Anger management, impulse control, parenting components if you can. And again, addressing any kind of comorbid internalizing or externalizing problems. But I would like to focus in at the end just on more of a novel idea for bullying intervention, which is thinking about, looking through the bullying research. A lot of that really fits with the idea of PreVenture. So the PreVenture is effective for internalizing and externalizing problems. It looks at people's personal vulnerabilities. So I figured that bullying probably would be, prevention probably would be effective for those involved in bullying, and maybe it could fill a bit of a gap in terms of that lack of targeted intervention for those involved in bullying. This paper with Patricia. Happily, we did find some pretty good effects. So basically, within the CAP study, where we're looking mainly at substance use outcomes as well as those secondary effects for mental health, we did more of a post hoc analysis on whether those people that were involved in bullying, victimization, or perpetration at the pre-PreVenture would have reduced victimization or perpetration after the program, as well as those co-occurring problems, so internalizing, externalizing problems. I won't go through PreVenture since you know about that, but just to focus on the fact that because PreVenture aims to increase coping skills and it really incorporates ways to manage their internalizing or externalizing problems as well as cognitions, then it really is a nice fit for a targeted intervention for those involved in bullying, both in terms of the risk factors for being involved in bullying and the consequences. There's quite good evidence that traits similar to negative thinking are linked to both victimization and perpetration. Anxiety sensitivity, not so much, a little bit higher in those involved in victimization. Impulsivity, again, in both, but more so perpetration, and sensation seeking, some evidence that those high in sensation seeking are more likely to be involved in perpetration. So even just thinking the personality traits themselves do align. So as we would do with PreVenture in general, within the CAP program, those that screened in with one of those 4 personality types were offered PreVenture. We ran PreVenture as normal, so this is post-hoc analysis. We weren't considering bullying intervention at that point. And overall, in terms of population sense, bullying, victimization, or perpetration didn't increase over the whole sample. But looking amongst those that were either victims or bullies at the beginning, there were significant differences. And I should mention, I only didn't include the bully victim group due to power, unfortunately. So it was getting quite small, particularly for perpetration. So within the victims, those that were getting frequently victimized at the beginning or pre-PreVenture were significantly less likely to be victimized post-PreVenture. So it reduced that kind of ongoing or chronic victimization. The directions were nice for perpetration, but there was quite a small sample of those that reported being frequently involved in bullying perpetration, so that those results weren't significant. Similarly, that was for victimization, so it reduced in victimization, but non-significant for perpetration. And then amongst the bullies at baseline, there was no significant results. However, amongst those that were victims at baseline, they reported significantly less emotional symptoms post-PreVenture and also significantly less suicidal ideation post-PreVenture. It's really important for thinking around targeted intervention for those young people involved in bullying. They're going to be more likely to have these high-risk personality types, but also we can address those co-occurring problems that are seen both in terms of maintaining the problems, but also consequences of the problems. And interestingly, we also found some significant results for those that were involved in perpetration at the beginning. So even though we didn't see their overall perpetration reducing, they did have more general reductions in conduct problems. And amongst the females, there was a significant reduction in suicidal ideation as well. And basically this editorial just agrees with us. So Lucy Bowes, or Bowes, a bullying prevention, bullying researcher, did suggest that maybe a personality targeted approach could really be a great solution for bullying. many reasons, it's hard to identify who's involved in bullying. It can look at risk factors and consequences, and there really is a big gap in terms of targeted intervention. This is just my final call to action. So it would be really wonderful if school-based bullying interventions could be holistic, so accounting for the interrelatedness of bullying and other emotional and behavioural problems amongst adolescents. It's evident that some level of bullying will remain in schools, unfortunately, so it is essential to arm those that are most vulnerable to bullying and its harms with effective coping skills. And it's important not to only focus on improving the external environment of schools, which is still very important, but to also focus on strengthening those young people's coping skills in order to curb some of that harm caused by bullying. Thank you. Feel free to reach out if you have any questions, or I can answer some now if there's any time.